If you're exploring options for hip revision surgery, you've likely already seen your specialist due to any number of complications with a previous hip replacement. In this video, I'll be answering some common questions around hip revision surgery. I'll discuss various complications of hip replacement surgery and symptoms that you may experience as a result that could prompt you to visit your specialist to explore the option of hip revision surgery. I'll discuss what is involved in the procedure, types of hip revision surgery, and your expected recovery. I'm Jibu Joseph. I'm a consultant hip and knee surgeon at Rossall Hospital, Glasgow. Rossall Hospital is one of over 50 hospitals that form Circle Health Group, making Circle the largest private healthcare provider in the UK. If you are in the initial phase of recovery from a hip replacement, your pain should gradually improve over the first 6 to 12 weeks, and your mobility should gradually improve throughout this period. If you're not recovering at the expected rate, you become unwell with an increase in hip pain or reduction in mobility, or your wound becomes a problem, it is important that you immediately contact the hospital that your procedure was performed in and your surgeon is notified, as you may need to be reviewed urgently. With that said, assuming you're past the first year after your initial surgery, I'm going to talk you through some of the symptoms you may experience following hip replacement that may indicate a potential problem with your hip replacement, and so might alert you to reach out to your specialist for further review. If your hip was previously pain-free, but you now have hip pain, this would be an indication that further review is required. Hip pain is commonly felt in the groin or thigh at the front. If the pain is in your buttock, it may be coming from your hip, but it could also be coming from your back or the joints at the back of your pelvis called your sacroiliac joints. You may also notice that your hip feels less stable, especially when you're standing on the affected side alone. Sometimes patients find it hard to describe instability, and so it presents as a general loss of confidence in the hip when weight bearing, especially if you're twisting or turning at the same time. For some patients, this is only with specific movements, but for others, they may feel that their hip is unstable with all movements. This symptom can be very troublesome and can really cause a significant restriction in your mobility and ability to go about your life as usual. Even if it isn't causing significant pain, it's worth reaching out to your specialist sooner rather than later. Another potential sign that you should speak to your specialist is if you're feeling that one side of your legs is shorter or longer after hip replacement. If the length of your legs is within 10 millimeters of each other, then most people can't tell the difference, but sometimes you can. This can sometimes be resolved quite easily with a shoe raise. Sometimes your legs may actually be equal in length, but due to your body positioning and spinal issues, you may feel that one leg is shorter or longer than the other. Again, this would most likely only require a shoe raise on one side. In quite rare circumstances, the leg length discrepancy is more severe, and in this case, you may need to consider revision surgery after discussion with your specialist. If at any time your hip wound becomes problematic, or you become unwell and you then develop acute hip symptoms such as severe pain, speak to your specialist. You know your body, and if something doesn't feel right with your hip replacement at any point, whether it's months or decades following your initial hip replacement procedure, it's wise to reach out to a specialist who can run some tests and necessary scans to check the condition of your hip joint. Your specialist will provide more information on whether hip revision surgery is the right choice for you, depending on the outcome of these. One of the most common reasons for hip revision surgery is to replace a prosthetic joint that has become loose or worn. This is more common in patients whose hip replacements were done more than 10 to 15 years ago, but it can occur sooner if you are especially active. If your hip has become loose or worn, it is common for you to develop pain, especially in your groin or thigh. This may especially be the case when trying to stand from a seated position within the first few steps of walking or after walking for prolonged periods. You may also notice that your hip feels less stable, or you may feel that you are not as confident standing on the affected side anymore. Another common reason for hip revision surgery is hip dislocation. Your hip is at greatest risk of dislocating within the first 3 months after surgery, but after this time period it reduces as the postoperative scar tissue matures. The risk of dislocation does, however, increase again after 10 years or so. As you get older, the stabilizing muscles of your hip potentially get weaker, and your hip may have become worn or loose. Dislocation of your hip joint usually results in an inability to walk, and so this would usually prompt ambulance transfer to your local emergency department. The number of fractures around hip replacements is unfortunately increasing due to the increased age of the UK population. Fracture around a hip replacement often occurs after a fall or some other traumatic event. This again usually results in an inability to walk, and so this would prompt ambulance transfer to your local emergency department. Sometimes the bone can be fixed around the existing hip replacements, but sometimes it cannot, and so the hip may need to be revised. A revision hip replacement is similar to your initial hip replacement, but there is the added step of removal of the existing hip replacement. Therefore, it is more complex, and so the risk of complications is increased. If you are undergoing revision hip surgery, you'll be assessed by your surgeon and the team. Revision hip surgery is commonly done under a general anaesthetic, but sometimes the procedure can be done under spinal. The reason a general anaesthetic is used is because the operation can take longer than the standard spinal would allow. This is, however, something that your surgeon and anaesthetist would discuss with you. The skin incision usually involves opening up the existing scar and extending it both up and down. You may therefore have a bigger scar than after your initial hip replacement. Hip replacements are in general either held to the bone with cement or without cement. Your surgeon will have various instruments available during surgery to remove the existing implants. This can sometimes take a long time, and it may involve breaking open the femur to allow safe removal of the existing implants. Of course, your surgeon will repair the break in the bone afterwards, but they may ask you to keep weight off your hip for slightly longer after surgery until the break heals. This may take up to about 12 weeks. Once the implants have been removed, the surgeon will now insert new components. The choice of implant used will be determined by your surgeon and is something that you can ask your specialist at your initial consultation. Once the new implants are in place, the wound will be closed. This may involve skin clips, or it may be a dissolving stitch. If you have a strong preference, you should feel free to discuss this with your specialist. A revision hip replacement is usually a much bigger undertaking than initial hip replacement, but it's important to know that we'll be right there with you following your procedure with the team of nurses, physios and your consultant advising you on the best recovery plan. The main aim of good recovery is to ensure that there is no infection as you heal and no further trauma to your hip. Your physiotherapist will work with you to regain the strength, mobility and flexibility in your hip joint to get you back on your feet again. Recovery can be more challenging and can take longer to heal from compared with your initial hip replacement. Because of this, you may need to factor in a more intensive physical therapy program, and you may need to limit your activity level for a longer period of time to allow for proper healing and safely build up strength and stability in your hip to avoid complications. If you return to high-impact sports or heavy lifting after your initial hip replacement and your hip wore out quickly, you may wish to consider stopping these high-stress activities after revision surgery, as re-revision surgery is again a large undertaking with a higher risk of complications, and so if this can be avoided, that would be advisable. So that was a detailed run-through of when hip revision surgery may be needed and what's involved with the procedure, recovery and aftercare. If you want to come and see me for a consultation to talk through any problems with your hip or to discuss your options for initial or revision hip replacement surgery, you can book online via the link in the description below, or you can alternatively search for your nearest Circle Health Group hospital and the next available consultant in your area at circlehealthgroup.co.uk. If you have any questions on anything I've covered in this video, please comment below, as we'd love to hear from you. Otherwise, thanks for watching.